When taking diagnostic images, they should be achieved on the first attempt to minimize radiation exposure to the staff. Women that are pregnant should not take x-rays because radiation can affect the fetus. Also, people that are 18 and under should also not take x-rays. Your cells are still developing and radiation can affect the growth of those cells. When taking x-rays, you want to put as much separation in between the x-ray machine and yourself, so you can use things like sandbags to hold the patient in position. You can use things like tie downs or gauze to stretch out an extremity so you don't have to be in the primary exposure of an x-ray. So this is my personal dosimeter. I have my name on it and everyone in the clinic has their own. The company that we use to monitor these devices, we turn them in quarterly. So every time I'm taking x-rays, whether it's dental x-rays or chest, abdominal x-rays, I always have my dosimeter badge on. So this is a thermoluminescent dosimeter. It registers a charge over time as it's exposed to radiation. The important feature of this is that it maintains a charge for the duration of time required by the facility. So when inspecting your x-ray equipment, you want to make sure that there is no wear and tear on the equipment, there's no rips. We do take x-rays of all of our thyroid collars, our gloves, and also our aprons every 6 months to make sure that they are still in working condition. So to protect myself from radiation exposure, the first thing I'm going to do is put on my lead gown, and we tie this in the front instead of using a belt. Also, we do have thyroid collars, and this is where your dosimeter is attached to your thyroid collar. We also do have lead gloves that should be worn when taking x-rays as well. So the maximum dose of whole body radiation is going to be 5,000 millirems per year. We turn our dosimetry report in quarterly, so our maximum dose is going to be 1,250 quarterly. So this is my dosimetry report. I'm going to read the report for myself. So our report breaks it down into deep, eye, shallow radiation. So all I'm going to do is add all these numbers together, and when I do, it comes out to about 570 millirems. So that is way below my maximum dose, so I am in the clear here. When you're taking x-rays, anyone that is pregnant or under the age of 18 should not be taking x-rays because their millirem dose is very low. Also, anyone that is non-essential personnel to taking an x-ray should step out of the x-ray room so they don't expose themselves to radiation without being properly protected. When you're taking x-rays, you want to make sure that none of your extremities are in the primary beam. That's the light that you collimate on the patient. I'm going to be demonstrating how to position a patient for x-rays. This is solely for demonstration purposes. I'm not actually taking the x-rays. I do have a sedated kitty. This is our clinic cat. So you can use things like sandbags or ties when positioning for x-rays. We actually don't have any sandbags, so I'm going to be using these big gloves. So if I were going to be taking an abdominal radiograph, I would just stretch him out and use the glove to hold him into place and focus my beam on his abdomen. I'm going to make sure that the gloves are not in the picture, or if I'm taking an x-ray of one of his extremities, you can use gauze. We use these tie-down leads, attach it to the extremity I'm going to be taking a picture of, and then hold the leg out just like this and focus my beam so it is collimated just on the leg. And I would take it just like this. We also do have a trough to get VDs. So I would just put the trough down and lay my patient into it on his back. And then you can take an x-ray just like this. I'm going to be demonstrating how to do a VD of his chest, so a thorax VD. I'm going to take my caliber, and we have a chart here that lets us know what settings to put our x-ray machine on. This is a digital x-ray machine, so it automatically processes the image and shoots it up on the screen for me. So since I'm doing a VD, I'm going to measure him from ventral to dorsal. So I'm going to find what I'm shooting, which is his thorax, and he was 11 centimeters, so he falls right here, and I'm just going to follow these down to this box, and this is going to let me know what my mass and my KVP need to be set on for the machine. So my mass will be 5.0 and my KVP will be 77. Just down below this, we have the machine's KVP and mass. So it's already set on 5.0 and it's on 78. That is as accurate as this machine will go. So this is where I'm able to change the settings on the machine. I have my seconds, my MA, my KV minor and my KV major. Now I will be doing a thorax VD. I'm gonna flip him on his back. I'm going to use a sandbag to hold down his legs. I'm going to collimate my light to where it's down to his last rib and then up towards his like thoracic inlet. And then I'm going to shoot the image just like this. I am going to be shooting a lateral abdomen of the kitty cat. I'm going to re-measure his abdomen to redo my settings on the machine. And then I'm going to change my settings accordingly. Once my settings have been changed, I'm going to collimate the light from about his pelvis halfway up into his ribs. So I'm going to shoot his abdomen just like this. This is going to be his right lateral. I don't have anything to label this x-ray because our computer does it for us, which I will show you in a second. So I'm going to go ahead and shoot this image. Now I'm going to be doing a craniocaudal of his radius and ulna. So I'm going to put him in sternal recumbency. I am going to use my sandbag or glove to position his head out of the image. I'm going to take my tie down and wrap it around his paw. I'm going to measure his arm, so I'm going to change my settings accordingly. I'm going to collimate my light just so it is on his arm, and I'm going to shoot the image just like this. Now I'm going to do a lateral of his tibia and fibula, and it is the same centimeter size as his arm, so I'm going to leave my settings as they are. I'm going to collimate my light just so it's exactly where I need it to be focused on. So now that I'm done with his x-rays, I am going to reverse his sedation and he will wake up. I'm going to be performing hip x-rays on this dog. She is sedated. I'm going to do 2 laterals and a VD. First, I'm going to measure at the tops of her hips, and then I'm going to set my machine accordingly. Now I'm going to position her for the VD, so she is going to be in dorsal recumbency. So when I position for a VD of the hips, I'm going to take her legs and twist them inward to make both of the femurs parallel, and I'm going to push it down as far as I can get. This dog actually does have some hip issues, so I'm not going to be able to flex it completely. And then I'm going to collimate my image so it's just focused on the hips. So I'm going to be taking x-rays of the premolars and the carnasial. I'm going to take some gauze and place it in her mouth just to help my cassette stay in place. Then I'm going to place the cassette right at the edge of the tooth, so it's just like this. And then I'm going to take the x-ray machine and place it right at the edge of the cassette at a 60-degree angle. The next image I'm going to take is going to be the carnasial, which is this tooth right here. And then I'm going to place the cassette right at the edge of the tooth like before. And then I'm going to angle my x-ray machine at about 65 degrees. And I'm going to take this picture. So once the images are taken, this is where the x-rays will go. So my first picture was a picture of the premolars, and this is what the image turned out to look like. This is a good picture of the premolars because I can see the roots of the teeth. I can also see the crown of it as well. And my exposure quality is perfect. The next picture I took was of the carnasial. The same thing. I can see the roots and the crown, and the exposure quality over here is in the green, so that means that the exposure is perfect. I'm going to be performing a barium GI study on this cat, so we're going to be using barium sulfate. His dose of barium is 45 ml, so I'm just going to give this orally, and then we're going to take a radiograph immediately afterwards. This is my immediate x-ray after administering the barium. This is his lateral, his VD. So now we're going to do our 5-minute take. This was 5 minutes after administering the barium. Now I'm taking my 30-minute picture. This is 30 minutes after administering the barium. Now we're doing the final x-rays, which is an hour post. And the final take, this is an hour after administering the barium. So whenever I'm gonna add a new study to take some x-rays, I'm just gonna push this patient button. I'm gonna type in the patient's first and last name, and then right here I'm gonna put in their patient ID, and this is going to link it to our computer system to save the file. And that's all that I have to do here. I'm gonna go to the next page, and then I'm gonna choose the images that I'm going to be taking. So in this case, I'm going to choose up here a abdomen, and I'm gonna take a feline lateral. I'm gonna take two, so right and left, and then also my VD, and then I'm gonna go to the next page, and this is gonna bring me to where I am able to take my x-rays, and they'll show up here on the screen. So when the x-rays are taken, they come to this screen, and this is where I can edit the image. So I'm gonna label this as my right lateral. So for this image, I'm going to add that this is an abdominal image, and I can just take that and label it anywhere here on the page. This one is my left lateral, so I'm just going to label it as such by putting the left marker and then also labeling it as the abdomen. And this is how we label our x-rays. So once the x-rays are taken, they are automatically saved in our computer system. So all I have to do is type in the patient that I'm searching for, and then it brings me to their file. And then over to the side here, it's gonna show me all the x-rays that we've taken for this patient and bring it up right here. So I can look at her barium study, I can look at her chest x-rays that we've taken, and it'll all be right here for me. So all of our radiographic studies, our endoscope studies, or ultrasounds, I can attach directly to the patient file. The first thing that I'm going to do is go to that patient. I'm going to open up a medical quick note text, and then from there I can attach PDFs, I can attach images. Any kind of study can be attached to this quick note, and then we'll also write a quick blurb on exactly what the medical note is. So the first thing I'm going to do is open up the patient. I'm going to go to medical quick note, type in my initials, and then from here I'll be able to attach an image. So we're going to attach this dental image, and we're going to label this dental x-ray. And this is where we attach all of our studies. So you just double click on your note, and then you'll be able to see the image right there. You don't have to keep a x-ray logbook for our machine because our machine keeps track of all of that for us. If we did have to keep a logbook, it would be put in our x-ray room. You would have to put down the patient ID number. You have to keep track of the mass and the KVP for that patient as well, how many images you took, what view of image you took, and then the date and the doctor's initials.